This child could lose his airway if you choose the wrong intervention. So if your child or your patient ever looks like this, you better run. This is an NCLEX case study. I'm going to give you presentation, vitals, and assessment. You are going to guess the disease of this little kiddo and answer 4 questions based off the disease. This is a 4-year-old brought to the ER for fever, trouble swallowing, and a sore throat. You want some vitals? Here they come. Heart rate 158, that's elevated. Respiratory rate of 33, also a little elevated. Blood pressure of 92/58. SpO2 of 91, this is on Romer, not doing so great, and a temperature of 102.9. On assessment, you see that he is tripoded, so he's leaned over, he is actively drooling, he has a muffled voice, and he is really ticked off and irritable. Based on what this kid looks like and the vitals and assessment, what disease do you think this child has? You'll answer in 3, 2, 1. This disease is called epiglottitis. It is an inflammation of the epiglottis, which is the little flappy thing that goes over your trachea. So it goes over your airway. So if this becomes swollen and inflamed, we could lose the airway. So being as though that's the case, what is, question number 2, your priority nursing intervention for a patient that you suspect has epiglottitis? You will answer in 3, 2, 1. This is to get a trach intubation kit and put it at the bedside. If this child loses their airway, okay, and the epiglottis swells to the point where it completely covers their airway, we will not even be able to get an intubation. We are going to have to do a trach intubation, so you need to prepare for that. You'll also call the physician and get the anesthesiology team. They're going to try to do a controlled intubation if they possibly can, which means to sedate the kiddo and to try to get an airway while he's calm. So what is the number one thing you are not supposed to do as a nurse if you suspect the child has epiglottitis? You can answer in 3, 2, 1. You are not supposed to look in their mouth. I'm not going to be like, hey, kid that's super ticked off and we don't want to lose the airway. Let me stick a tongue depressor in here and take a look around, because it's going to make them really mad and we could lose that airway. So leave their mouth alone. And you leave the kid alone too, okay? Because he just needs to just do his thing, all right? Next question is, what is the causative organism? What causes epiglottitis? You have 3 seconds to answer. 3, 2, 1. The causative agent is Hib. This is Haemophilus influenza B. This is not the same as HIV. This is not the same as hepatitis B. This is a bacteria called Haemophilus influenza B. All right, a bacteria. This is a bacterial infection causing inflammation and swelling of the epiglottis. All right, last bonus question. What are the 4 Ds of epiglottitis? There are 4 Ds, which means 4 signs and symptoms that start with the D. 3, 2, 1. All right, those 4 are going to be drooling, dysphagia, which means trouble swallowing. They come in distress. They're really ticked off, and they have dysphonia, muffled voice. All right. How many of these did you get right? Did you answer the disease correctly?